Nucci from Nucci Medical. Thanks for joining us for our Friday Now Coffee Talk with our coffee, as we have. So hold that up there. Our Nucci Medical coffee, coffee cup, and coffee. Today's talk is on spine and hip injuries, and the relationship between the spine and the hip is something that we've come to understand more as time has gone on. They're not isolated areas; they're two different things, but they are connected. And although that seems obvious, sometimes not so obvious. We have physicians who are spinal surgeons, and so we'll look at the spine. You have physicians who are hip surgeons, hip replacement surgeons, or even hip arthroscopy surgeons who look at the hip. And sometimes you don't realize how one problem can affect the other. One of the things I always say to patients when I'm examining them and after I've looked at them and they're complaining of low back pain and so on, I always say that one of the causes of low back pain are hip problems, hip injuries. So it's very important to examine the hip when you're doing a spine exam, because hip pain can refer up to the spine. Knee pain can too, to an extent, but hip pain really, can. And there are instances where people have been operated on for one part or the other, and it turns out it's really the other part that is the main cause. So you want to avoid that kind of thing. One of the also important things that's been come to understand as time has gone on is the relationship of movement, walking, with the spine and the hip. People associate, when you walk, your hips are walking, your knees and your hips. But really, it's a spine motion to a great extent. There are videos out there, I think, on YouTube of people who have had disarticulated legs for whatever reason, tumor or trauma, and it's just in their pelvis and their upper body. And they can walk to an extent, or ambulate, whatever you want to call it, across the floor, because their pelvis is moving, their spine is moving. So spine motion is important for walking, as is hip. So you can see that there would be a relationship, between the two. As a matter of fact, now, another thing that's we've learned, although I'm not a hip surgeon really anymore, one of the things that our hip replacement surgeons have become concerned about is spinal fusions. So when you have a spinal fusion, they notice that there are hip replacements disarticulate, come out of joint more than they would normally expect if a person hadn't had a spinal fusion. And they started to look at that and say, well, there's this relationship that we didn't really know. When the spine doesn't move the way it normally does, it puts abnormal motion on the hip, and that can cause the hip to disarticulate or cause hip pain if they don't have a hip replacement, and vice versa. One can influence the other. Bad hip motion can lead to bad spine motion, give you low back pain. So these things are related. As far as our hip surgeons go, they take that into account, and they rotate the hip replacement one way or the other to make sure it's less likely to disarticulate when the person is walking, which is obviously a bad result. So we understand now the relationship between the hip, not completely, but we understand better the relationship between the hip and the spine. So if someone has hip pain, you want to look at the spine as a referral source, and vice versa. And now there's different kinds of hip pain. Hip pain is very complicated. It's not a simple thing. And as time has gone up, we've come up with new names for things. In the past, we would say hip arthritis and hip bursitis, but actually there's a lot of muscles that are moving across the hip, and different ones can cause pain in different ways from different activities, different sporting activities. So, having hip pain and figuring out what the cause is also another challenge for us. But the important thing is the relationship, between the two, and the fact that both are really needed, for walking. And injuries to one is likely to affect the other to some extent, and back and forth. So hip and spine closely related in pain and in walking. and need both to be considered when someone is having pain in their hip or pain in their back. You want to examine and make sure that it's not both problems, or one problem is the cause of the other problem, that kind of thing. So that's the relationship of the hip and the spine. I think that's about all I really wanted to say about the hip and the spine. It's a much more complicated topic, but from the high level, I think that's what people need to understand, and not be surprised if they go into a physician and they're examining their hip. And so, what are you examining a hip for? Well, because it can cause problems. It's very common. It's actually very, very common, either as a primary or secondary cause. And there we have our hip and spine for our somewhat more accelerated talking, a little coffee. I'm talking faster probably. But in any case, let's see if there's any hip and spine questions out there. Let's find out. I don't think anybody asking anything about hip and spine today. But and just as an aside, one of the things that helps both the hip and the spine is walking. Walking does help. Certainly, if you have a lot of arthritis in your hip, it's harder to walk. But if you have hip bursitis, this kind of thing, walking tends to be an activity that makes everything move together appropriately, and can often help. So bear that in mind with your hip and spine problems. Let's see. Does hip replacement affect the spine? I sort of parenthetically mentioned it, but if you have a hip replacement, what would it do to the spine? Well, one thing one needs to know and understand is hip replacement, or any joint replacement, it's not a normal motion. It's not a normal motion being replaced. It's close. It's pretty good. It's not exactly. So to the extent that it's off, it can throw off another body part, your knee, your hip. Not common, but it's something to bear in mind. So a hip replacement will, at least initially as you're healing, certainly throw off the way the spine works and the way the spine moves, and can give you some low back pain. However, as you rehabilitate and things get back closer to normal, that should resolve. But it is not completely normal motion, and that one needs to understand that spine motion, that hip motion, is not exactly normal and can cause other related problems. Although fortunately not very common. But as I said, one takes into consideration the spine now when doing a hip replacement, not so much the other way around. Hip replacement, it affects the way you do your spine surgery. That hasn't been a factor, but spine to hip, that has been a factor. Let's see, does spine fusion or disc replacement affect the hip? After that kind of surgery, can a patient have more hip problems? Yeah, we sort of been touching back and forth on this, how the relationship in the hip and the spine. And we talked a bit about a spine fusion, right? I was saying the spine moves when you walk, and that affects your hips move, and everything's moving together, and that's the way it should be. But a spinal fusion, one of the spine isn't moving quite the way it should, and it can throw off the hip and cause problems in that area, or problems for a hip replacement. Now, a disc replacement in the spine, fairly big surgery, but the idea is, at least from the standpoint of motion, is that you put in a disc replacement because it maintains some of the motion that you had at that level, so you don't lose motion at that level. And more importantly, probably, is that the other areas around it don't wear out quite as fast, because they can still, that level still moves, and the other levels don't have to move more to make up for motion lost. But from the standpoint of, can that affect the hip? No evidence to this effect. However, one would think that because the spine moves more normally with a disc replacement, it's less likely to affect the hip, maybe. Again, not normal motion. That spine motion with a disc replacement, as any artificial joint, it's not normal motion, it's close. So to the extent it's not perfectly normal, it's going to throw things off to an extent. But you would think that because it's still moving some, the hip is less affected. No evidence to that effect. I have no experience with it. People coming in with disc replacements and complaining of hip pain, haven't had many of those in my practice, but I would think that it would be less likely for the disc replacement, but that there's no evidence to that effect, but it makes sense. Let's see if there's any other. Here we go. Oh, I said, great, thank you. Well, there you go. That's good. I appreciate it. Those are good. That's actually those are very good questions. And maybe we'll do a coffee talk a bit on disc replacements at some point in the neck and back. That might be an interesting topic, and why one does them. I think I may have done something like that at one point. Why one does those kinds of things, not always for what people think they're doing it for. Let's see. Any other interesting questions here? I don't think we do. I don't know how long I went today. We don't have a clock, so maybe I'm dead on time. Let's see. Yeah, that's that. I think that's the stint of questions for today. Thank you for joining us for our coffee talk on hip and spine related injuries. And I think I forget what we're doing next week. We'll come up with something exciting. Please give your ideas, questions, reviews, and we can come up with other things to discuss and talk about, things that are a bit confusing to people that hopefully we can explain and make them somewhat less confusing. Thank you very much. Have a good weekend, and I will see you next week.